Good afternoon, everyone. I hope this Wednesday finds you well here on April 8th at 3 o'clock. Thank you for tuning in. The format for today, we have a couple of folks with us. We're going to talk a little bit about some leftover questions from navigating COVID-19 from Dr. Shear and Ann Hopper. We have a couple of questions that we didn't answer from yesterday. Matt Dameron is here, our Associate Executive Director, to talk a little bit about the licensed side of our campus, assisted living, memory support, and the health center. Florence and Trish are here to talk about Holy Week, and then I have some other administrative items to discuss. So first, I had up on the list here about Easter photos. So Trish did want me to make notes here that Easter photos, we are in the hunt for photos of children, grandchildren, and great-grandchildren. So if you have pictures, Trish would love to retrieve those pictures. If you don't have access to a scanner, just use your smartphone, take a picture of the photo with a reference of the person, your name, and who's in that photo. Send that digital photo to Trish Carter by noon on Friday, here April 10th, or you can email her at tbcarter@pinnacleliving.org. There'll be a slide posted on 970 about all that information, but she is looking for photos. She has something special in store for everybody this weekend. Next, just want to, those of you that did not tune into the governor's 2 p.m. Media briefing here today, just wanted to catch you up with some of the highlights related to that briefing. The governor talked a lot about five different areas. The first being PPE, otherwise known as personal protective equipment. There was a lot of questions about the availability of PPE in the Commonwealth of Virginia. And he wanted everyone to know that the state has on order several million surgical masks, N95 masks, and specifically gowns, those three items within PPE, and that they should be delivered to the state here this week. They continue to market and procure additional PPE. It's a very competitive market right now. Obviously, people are needing the same item across the globe, and so the state is actively working on procuring those items. Secondly, he wanted everyone to know that in and around the Commonwealth of Virginia, that the hospitals, to his knowledge, have not run out of any PPE, so that's good news. And in fact, on a conference call this morning, that is true of the 5 main hospitals within the Richmond market. We are not experiencing any shortages, and I know that to be personally true. My wife works at 2 of those hospitals, and they have plenty of PPE up on the floor that she works. He did mention, thirdly, that we are moving the primary dates from the primary election date from June 9th to the 23rd. And I received a couple of emails this morning from some residents about is Cedarfield continuing to be an election site. And so far, we do have plans to be an election site as we have for many years. We have not worked with the election office yet of what that June 23rd date would look like for Cedarfield. He also talked about health data. Since this pandemic has really been with the world since December, there's a lot of data now available from a variety of countries. There's a lot of data available at our fingertips right here in the Commonwealth. So the state, along with our local Department of Health, is using that data and the science behind that data to really determine whether or not each specific county is adhering to self-quarantining and flattening the curve. So look, he did make a brief reference that he would be sharing a little bit more of that data in tomorrow's press conference. They did talk about COVID-19 and the number of cases that we have in Virginia, which is 3,645. That's 312 cases of an increase from yesterday, this time yesterday. The unfortunate news about deaths related to those cases, there are 75 in the Commonwealth, and that is an increase from 12 from this time yesterday. It was interesting to me that he pointed out that we are only one of 12 states that report ethnicity and race data in conjunction with all this other data. So that was an interesting tidbit for me. And the fifth area that he didn't touch on it as one of his topics, but the media was very inquisitive about long-term care. They asked about 3 or 4 different questions, and the governor just repeated that this population is a very vulnerable population, people 65 years of age and better, that he is very confident that the Department of Health at the local level is working very closely with the providers in increasing surveillance. And I can tell you that's certainly true because I talk with them almost daily. He talked about lessons learned here in the Commonwealth thus far and lessons learned from other long-term care facilities around the country, and that being of quarantining. So Matt and I are going to touch a little bit about how we're going to be more proactive about quarantining here in a couple minutes. He talked a lot about social distancing is the key, even in the long-term care settings. They talked about Leading Age Virginia, an organization that we are extremely proud to partner with. The crew over there, a mighty crew of 5 people, they do an amazing job of serving on the providers' behalf of advocacy across the Commonwealth. And the question really had to do with sharing staff, going between different organizations, and the ability of not only Leading Age but the Department of Health to relay information from one organization to another when a staff member has come down with COVID-19. So he reiterated his confidence level that the local Department of Health officials are working in concert with providers to really let those providers know of when somebody comes down with with COVID-19, but more importantly, to know that that person might also be working at other campuses around the county. And Matt and I are going to talk about that as well in a couple of minutes. And then the last question that the media asked was guidance about asymptomatic or a staff member that's exposed to COVID-19, and why are all these frontline staff still working in long-term care? They don't seem to be essential, is what the media reporter was trying to get at. And the governor had talked about that and I aspire to this definition as well, so does Chris Henderson, our Chief Executive Officer, that every person in not just the nursing home or assisted living or memory support, but on this entire campus is essential. That's why they work here to begin with. And so he talked a lot about healthcare workers are on the front lines. That's why we have a little sign out on Three Chop Road saying heroes work here, because everyone that works here or is a private duty person or an agency that works here is on the front lines working as hard as they can to protect residents. He talked a lot about that healthcare workers, not just the CNA, this is my opinion, not just the CNAs or the LPNs, but those that work in our field, so to speak, there's not plentiful numbers of us that want to work in and around people 65 years of age and better. And so he talked a little bit about the supply of people working in this industry. He talked about monitoring from symptoms, which he has a very strong confidence level that the local Department of Health have been working with the providers in identifying symptoms to look for with team members. And once folks have certain symptoms, to work through an algorithm to determine whether or not they should be working at the campus. So that's the governor's briefing. And if you have any other questions about that briefing, please feel free to call down to the administration suite. Next up is Ann Hopper with our, seems like 2 or 3 times a week, our topic called Navigating COVID-19 with Ann Hopper and Dr. Shear. We missed a couple of questions yesterday, or there was really one extremely important question that came in this morning that Ann and I would like to talk about. Hello, how are you?
I'm good. How are you doing?
I'm doing great. So before we go into those questions that we didn't get to yesterday, I want to talk a little bit about the wellness clinic volume. So Ann, before this whole COVID-19 situation occurred almost 30 days ago, believe it or not, I know.
Wow.
How many residents do you think that the wellness clinic, you and Bonnie and all the physicians, how many residents did you think you saw on a weekly basis?
I would say with everyone involved, labs, blood pressure checks, doctors, probably 100 people would be coming through. And that's probably on a slow day when Narang, our podiatrist, was here 2 times a month. He would see about 20 in the clinic.
So 100, how many, 100 a week? 100
a week.
100 a week. So before this whole pandemic, I want to give everyone a little context to this. Before this whole pandemic started, we saw over 100 different residents in that clinic for a variety of situations.
Right.
So over this last week, how many phone calls have you received about blood pressure checks or anything related to allergies or any other things that you and Bonnie and the team would be working with residents?
Hardly any. Not much as far as any symptoms someone might have. Just different phone calls. I've done a couple of FaceTime. 2 were with community doctors. So very few telemedicine, and we are certainly happy to do that because they would be great just test run. I could do it with you out there in your apartment or your cottage instead of waiting until you really need it and then we're trying to figure it out, which we ended up last week. We had a resident that needed to see his doctor via telemedicine and it didn't work. So we ended up FaceTiming. So we're able to do it.
So why do you think over 100 residents saw you every week before this whole pandemic? Why do you think we're down to less than 10 right now a week?
I wonder if it's fear. Just afraid if you call me and say, I'm short of breath, or maybe I have a fever. Maybe you think I'm going to call 911 and everyone's going to come in those hazmat suits and we're all going to look different because we're going to be all geared up and we're going to send you out to the hospital where there's a lot of coronavirus. But we're not going to do that.
We're not going to do that. The whole point of this is at Cedarfield, Ann Hopper and Bonnie Berry and the physicians in that clinic are critical to your overall well-being.
Right, exactly. We want to keep you in the cottage and the apartment and help you from afar. And if we need to come in, we have the personal protective equipment to wear to come in and help you. So you're not gonna be left there figuring it out on your own or calling your family and then us calling 911.
Right. We want residents, if you have the sniffles, if you think you have a fever, we want you to call the clinic so we can help you get in front of it or alleviate fear. And so our concern going from 100 people a week to less than 10 is that a lot of people are going underground because they don't want management to know about anything for fear of being shipped out to the hospital.
Exactly, because it's even allergy season right now. So a sore throat or the runny nose or the sneezing could really be just allergies. So you don't have to suffer in silence.
Yeah, good. What was the other question? Oh, telemedicine. Can we go back to telemedicine
Yes.
for a second? So, over the last 30 days, Anne has worked hard with Dr. Baranian, Dr. Cook, and Dr. Shear on developing a telemedicine program. And so we want to continue practicing that program, right?
Exactly. It's either, we can go back to just the phone call back and forth if you don't have anything, which would be a smartphone, an iPad, or a computer, a laptop, or a desktop. So we could do the old-fashioned over the phone, and if you needed to visit, I at the very least would be going in. If not, with one of these electronic devices, we could set up the phone call. The doctors type in the notes right there, and we take pictures and send them back and forth, and then they can prescribe whether you need an antibiotic or you need say prednisone or something to help with breathing. The doctors can be involved, and we're seeing that these doctors out in the community want to do it too, because they don't want people coming out. They don't want people coming to their office. And if you are one of the few that go to the office, that office is just open for one person. And their protocol of getting you in there, it takes a lot. They're not seeing people face to face anymore. Not right now.
That's definitely true. Any other questions before the big one that we?
One big thing, Michael, I don't know if you've heard, but we still have people going out, leaving Cedarfield.
So one question that came across from residents yesterday, and I apologize, I was trying to navigate my phone, filling the questions, but we had 17 questions yesterday that came in during our live stream. And the theme of the question was, is it okay that we leave Cedarfield and go visit our family, or our son, or our daughter, or our children? Is it okay that we go over to Deep Run Park and hang out with 10 or more people? Is that okay? That's the theme of the question that came across.
No, it is not okay. I have a daughter local on the other side of Deep Run Park, and we will not be seeing her for Easter. Because people go different places, even family members, and you can go out and not have any symptoms, and you can meet a son or a daughter, and they don't show any symptoms, but they could be carrying this. This is the scary part of this virus. If you have a cold, you might cough and sneeze, and you might feel hoarse or sound hoarse, so you wouldn't go around anyone. But with this virus, some of us think, oh, I'm good, I don't have it. I use my mask, I wash my hands, I can go visit. But that's all it takes, one person being somewhere else, and then that next person talks to someone else, and it just multiplies and multiplies, and somehow it's in Cedarfield.
So many folks today and over last night have said, you know what, Cedarfield is just being too conservative.
And you know what? It's not conservative enough. I was talking to Dr. Shear after our Navigating Corona, and she watches a lot of webinars from Washington, the state of Washington and California to learn And these nursing homes want us to learn on the East Coast, so we don't have what they went through. And she said, the ones that are fanatic about not getting this virus are the ones that don't get it. The ones that are obsessive and feel like we are locking down everything and not letting anyone do anything, there's a reason.
And so those team members that are watching, also just a caution to team members who are thinking that we are too conservative because they have friends that work at other nursing homes or assisted livings or retirement communities. There are also team members that think that we are being extremely cautious and conservative because other retirement communities aren't at this level. And so I'll just share that this is our choice, this is our preparedness plan, and as things are evolving and as information is coming our way, and as we are transparently working with the Department of Health and the Virginia Coalition of Healthcare, along with our friends at the Pinnacle Living Office, we believe that our plan is great, and it's evolving, and it's going to get tighter over the next couple of weeks as Richmond's curve, we're not even at, when we keep talking about flattening the curve, we're nowhere even near our peak of our curve yet. And that's coming at the end of the month, so. Okay, any other tidbits you want to share?
No, we've covered it all.
Okay, great.
All right, thank you.
Thank you, Ann, appreciate you.
See you
This
again.
is one of Ann's quotes. You're not stuck at home, you are safe at home.
I like it.
I love it. Just a word on masks. Again, thank you to all the seamstresses. I did leave out one person, Mrs. Rucker. I apologize. I know that you have been actively working as well. Thank you, Lisa G, for helping me remember about Mrs. Rucker. We have essentially delivered over 270 cloth masks to team members. We're trying to have our seamstresses, along with some other people outside of Cedarfield, make at least another 150, and then we're going to guarantee that every team member, every private duty person, and every agency person has a cloth mask. One of the most frequently asked questions that Renee has received this morning in the administration suite is, can this, either the residents have an N95 mask, or do we have masks for every resident? And the answer is no to both of them. We don't have an N95 mask for every person on the campus. Matt and I are going to talk a little bit about PPE that we have here. We encourage the residents to make your own mask. There's very simple guidelines of how to make it. 2 pieces of cloth, 100% cotton. There is a video on our Pathways to Wellness module. I say that, I'm not saying that 100% sure. But I will definitely make sure that we have how to make a simple mask on our Pathways to Wellness module. So that's a little update about masks. So yours truly is wearing one in all common space areas, and that's our goal by the end of the day, to at least have every team member, every private duty person, and every agency person be wearing a mask. So, is Matt in the green room?
Okay.
Matt is in the green room. So this is Matt Dameron, for those of you that had not the pleasure of meeting Matt yet, our Associate Executive Director. You want to talk a little bit about, how are you? First of all, I haven't seen you all morning.
I know. We even try to keep our distance from
Right.
each other
Yep.
as much as possible.
So as Matt is going a little bit into detail about the Health Center Assisted Living and Memory Support, I'm going to exit stage right here for a couple of moments, and then I'll come back.
Sounds good. Well, good afternoon, everyone. I'm happy to be here with you to just give you some updates from our neighborhoods. in the licensed portion of the building. So that's Sunshine Plaza, assisted living, and then our 3 households in our healthcare center. So just want to go through a few things that we're doing, that we're ramping up, a few things that Michael and Ann mentioned a few minutes ago. So first, starting out, as we've been saying, and luckily we can continue saying for right now, we have no known cases of COVID-19 or influenza in our licensed portion of the building, or any portion of the building. Anywhere on campus, with our residents or our team members. So, which is a great thing, we're very proud of that, and we're also being hyper vigilant with residents, especially in the licensed areas, and team members that may show a little symptom here or there. Kind of like Ann was saying, it is allergy season, and we don't want to automatically send people to the hospital or out to the doctor if we can avoid that. So early detection is very, very important, and we've been encouraging our residents and our team members to let us know, and we're keeping close eyes on them so we can really address those things. And again, catch things before they come in the building, but also just as a time to educate, to make sure that people don't get anxious about a symptom that they might be exhibiting. We are still taking our residents to the absolutely necessary doctor's appointments. And even then, we are taking a lot of precautions with that, with our drivers, with our residents going out. We feel like that's going really well, and we appreciate you all being patient with us in regards to that. And we also have protocols in place for when residents return from the hospital. Hospitals are treating people with COVID-19. And we've had a few people that have had to go out for various reasons. So there are measures in place for when they come back, and essentially quarantining them and keeping quite a few eyes on them just to make sure that we're in a good place with that. So Michael just mentioned kind of ramping up our precautions building-wide, and especially in the licensed portions of our building, and that is what we're planning on doing. As he said, Virginia is approaching that apex in the curve in the next few weeks. So this is really the time to take those extra steps, those extra precautions, to do our best to keep this out of here as long as humanly possible. So we're taking some of those extra steps. Some of those include having different entrances for the levels of care. Right now, we have a couple of common entrances that our team members use, that our private duties use, and if we're trying to separate that as much as possible so that in case we do have a case or some type of sickness, then we're really kind of limiting it to a certain area of the building rather than people all going through the same entrance and going all over to different levels of care. So that's something that we're working on with Jack and the maintenance team that we will hopefully be doing in the next couple of days. As Michael mentioned, wearing masks. You'll see all of our team members and private duties wearing masks. If they aren't already, they will be by the end of the day. The vast majority of them have been wearing them all day today. Just as an extra precaution, we are also kind of we're looking at our schedules for our nursing team and making sure that we're not sharing team members with other areas of the building. So with our culture change initiative, we've really gotten rid of a lot of that, where team members are kind of floating from one area to another, and we really concentrate on trying to provide that consistent staffing so that residents know the team members know the residents. But we do have a few people that are very part-time that might pick up shifts in different areas of the building. So they might work in Sunshine Plaza and they might pick up another shift a couple days later in the healthcare center. So we see that as an area of opportunity to really limit that and try to keep those team members only in one area of the building. So just in case something happens, or if that person is exposed to COVID-19, then we can really limit the area that they were and the people that they were interacting with. So looking at that, physical distancing, again, during meals, we've been doing that, but now we're getting a little bit more vigilant with that. We have residents that, the vast majority of residents that are eating in their rooms. And then we have some residents that need assistance with their meal times. And we are appropriately spacing them apart and trying to keep dedicated people with those residents as well. Programming, again, group programming, we are not doing that. Individual programming with residents. We do snack carts, and the team up there is doing a really good job of taking snacks around, or cake, or all different types of things to try to lift morale as much as possible. And and a lot of video conferencing. A lot of that, it is still a great opportunity for our residents to reach out to their friends and family and loved ones. And again, another thing that we really didn't concentrate on, to be honest with you, at first, a few weeks ago, was making sure that our team members are also distancing themselves from each other. Mainly during break times, during lunch times. There for a little while, we had team members kind of gathering together, and now we've really made an effort to keep them apart as well during that time, and even alternating some of the break times so that people can take their breaks at different times in different locations. And one of the biggest ones, I think, is education. I think that is a huge piece of COVID-19 and the way that we do our operations here at Cedarfield. Connie McGowan, our clinical leader at Assisted Living, has been a tremendous help with that, holding in services for the team members, but also over the last, few weeks, I've had countless conversations with residents and family members, just trying to explain our processes, but then also explain the virus itself and try to clear up those common misconceptions. And we're doing the same thing with team members as well, because our team members are great, they are dedicated, but we want to make sure that they're educated as well, so that if we do have someone that has the sniffles, we don't kind of have a panic on our hands. And they've been doing very well with that, and I attribute that to a lot of the education that we have. Two more things. I'm going to talk about zip walls, and so let's start with that, the zip walls. So again, it might sound a little overbearing, but we really think that this is necessary. We're trying to, especially in certain areas, separate out certain groups of residents and put up essentially plastic zip walls. Again, trying to limit the exposure rate, potential exposure rate, if something does come in this building. Right now, as you know, our healthcare center, one day we'll have 3 gorgeous neighborhoods in 3 separate areas. One day, many years from now. I'm just kidding. But right now, it is one long hallway. So we really think that that is a huge area of opportunity for us, to divide that up as much as possible, and same with Sunshine Plaza, same with assisted living, so to minimize that exposure for people. So we're getting with our maintenance team, Jack and the team, to look at possibilities for kind of sectioning off certain areas, as especially over the next few weeks as we kind of, again, reach the top of the curve. And then the last thing I'll mention, I think Michael touched on it a little bit at the beginning, is another area that we've identified that we want to concentrate on are team members and private duties that may work at other locations other than Cedarfield. It is common that people have 2 jobs, maybe 3 jobs, or have something on the side where they work here as a CNA and maybe do a private duty type situation in an individual's home out in the community, a family friend or something of that nature, or work at different communities. So the neighborhood teams have been working really hard at talking to all of those people, all of our team members, all of the private duties that are still coming on campus, that are providing that necessary care to our residents, and identifying the ones that work in other places, so that we have a go-to list that we can really concentrate on. And if we hear of any cases or have any questions, we know exactly who to go to and exactly where those people are working. I think that's going to work out really well for us, and help us kind of eliminate that area of opportunity. Okay. And then the last thing I'll say really is about staffing. Again, I keep saying this over and over again. I'm so happy with our team members, their dedication. We've been doing really, really well with our team members coming to work, working hard, being very diligent with all of our practices, and I'm so happy with that. And even when we do have call-outs or people that can't come to work for various reasons, just want you to make sure that you know that we have other agencies that we work with, that 2 main agencies, staffing agencies that we can pull from to help fill those holes. So right now we are in a good spot with that. And so that's that from the neighborhoods. And one other thing that I'll mention is Operation Wellbeing. I just came from that meeting right before this chat, and we are looking at ways that we can connect and care for residents that need that extra support during this time, because it is hard. It is a very difficult situation to be kind of quarantined in your area, in your apartment, and not have those connections. So we have a team of great people from various departments here on campus that are reaching out to our residents, making sure that they're doing okay, and if any type of service we can help them or connect them with. And so again, if you know of anyone that might need some assistance, some help, please reach out to myself and Hopper, and we'll get you connected and help you out. All right.
Thank you, Matt. One tidbit about zip walls. Those of you that don't know what a zip wall, Z-I-P wall, it's a plastic sheeting that's held up by some
Yeah, they're like spring-loaded rods.
Thank you.
Yeah.
Good work, Amanda.
I know.
And so you use these zip walls to create a barrier. So we had a meeting with the Department of Health here on Sunday, and she said, tell me more about how your plans have evolved. And this Department of Health Representative Shirley, she said, you're doing zip walls. And she said, we have a conference call tomorrow, meaning Monday, two days ago, and I will share that best practice. So I talked to her yesterday. She shared that best practice with the other Department of Health representatives, and hopefully it's making a difference at other locations in the Richmond area as they're working through their plans. So, good. All right, Matt, thank you.
Thank you.
Appreciate you being here. Next little tidbit has to do with a construction update. So Monday I announced that we were going to proceed with the water detention system at the Parkview entrance. And I just came out of a meeting probably about an hour and a half ago to confirm some details and to confirm the date. So in your meal delivery tomorrow, there's going to be a little memo and a map that I will provide everybody that goes into detail about this specific 4 to 5 week project out by the Parkview entrance. So we're going to commence on Monday, and we're going to finish this project, the water detention system, along with finishing the fire entrance road all the way down to that circle. We're going to complete this project here in the next month. So again, we're going to start it on Monday, and I will provide more detail for you about the project in a memo form that'll be attached to your mail delivery tomorrow. Just a couple of other tidbits about transportation. We are still providing necessary medical transport for urgent situations from the clinic. If anybody has a need for transportation to a doctor's office, please contact Ann Hopper. The drop-off supply shuttle program is going very well. Cottages had the chance to, those of you that live in cottages had the chance to have your loved ones drop some stuff off over a park and ride at Gaskins and Mayland. That went very well today. And then on Friday, those of you that live in the health center and or assisted living and memory support, your loved ones will have a chance from 1 to 3 on Friday to drop all those supplies. The supermarket shopping with Ann Reed is going very well. We will again have that service available for tomorrow. Hopefully everybody has the flyer that we published over the weekend about the new approach to this supermarket shuttling program. So please refer to that flyer for more details about the supermarket shuttle. And then lastly, hot news off, I can make that announcement? Are you sure? Okay, I'm gonna make an announcement. So here's just a feel-good announcement. Many residents are missing ice cream. It is the most frequently asked question. Can you just deliver a scoop of ice cream with our meal? And we don't really want to do that because we don't want you to have a chocolate shake or a vanilla shake once it gets there. So James Green and David Stewart and Jim Veneer have been working very hard at procuring those little pint-size servings. And the news just came across the desk here that starting tomorrow, that ice cream will be available downstairs in the Cedar Field shop. What a nice treat that is. That's just some great news. See, we work on the fly here. It's just great. Again, thank you to all the residents, for those of you that have been working in and around the program for the U.S. Postal Mail Service and coming down at specific times in your specific time. We cannot thank you enough. Our U.S. Postal Carrier thanks you. It has made our life a lot easier, and it's made your life a lot safer. So thank you for your acceptance of this. I know this was a hard one, but we're now in a rhythm as a community, so thank you. We have no known cases of COVID-19 at Cedarfield at this time. We don't have any even influenza cases at Cedarfield at this time, knock on wood. Every single one of us absolutely has a role in being part of the solution, and I could not be more proud of what we are doing here. Residents and team members alike, we are doing an amazing job of sheltering this campus, protecting ourselves, and protecting one another. I cannot thank you enough for all that you are doing. We're doing a great job. So with that in mind, I'm going to turn it over to Trish Carter. Hi, Trish.
Hello, Michael. Hello, everyone. Good afternoon. I'm Trish Carter, and it is my absolute joy to serve Cedarfield as a chaplain. I do want to remind you of the Easter picture request. That was the first thing Michael brought up. On the Cedarfield app, under Pathways to Wellness, the very first thing at the top says Easter Pictures Request. Would love to gather pictures, family photos from Easter's gone by, or maybe some current pictures of children, grandchildren, great-grandchildren. You will be seeing those pictures again Easter Sunday. Pastoral services during this Holy Week will offer a Maundy Thursday service that will stream live tomorrow at 4, and on Friday, also known as Good Friday, at 10 a.m. on channel 970, we will stream a video that has works of art representing Holy Week. Lastly, I would like to share with you a prayer attributed to St. Augustine. God of life, there are days when the burdens we carry are heavy on our shoulders and weigh us down. When the road seems dreary and endless, the skies gray and threatening, when our lives have no music in them, and our hearts are lonely, and our souls have lost their courage. Flood the path with light. Turn our eyes to where the skies are full of promise. Tune our hearts to brave music. Give us the sense of comradeship with heroes and saints of every age, and so quicken our spirits that we may be able to encourage the souls of all who journey with us on the road of life to your honor and